Hey, Amanda Curtis, nurse practitioner, and today we're going to go over Tesamorelin. So going over FDA approvals, mechanisms of action, who it could be useful for, and things to look out for. So let's get into it. So Tesamorelin, brand named Egrifta, is FDA approved for HIV lipodystrophy. Specifically, it helps target visceral fat. So the distribution of fat around the midsection for patients with HIV. So the main difference being that Tesamorelin is a synthetic version of naturally occurring growth hormone releasing hormone. And the reason that they modified it is because the natural version only lasts for about 5 to 10 minutes, whereas Tesamorelin, it will last a little bit longer, but it still preserves the pulsatile nature of growth hormone. This modification stabilizes the molecule against proteolytic degradation by DPP4 dipeptidyl peptidase. Tesamorelin was approved by the FDA in November of 2010, and this was following a major multi-center randomized double-blinded placebo-controlled phase 3 clinical trial that encompassed 806 HIV patients, all exhibiting distinct abdominal fat accumulations. So this is an FDA-approved peptide that we can use for visceral adiposity. I do recommend this for my patients going through perimenopause and menopause, for women who are exhibiting signs of visceral fat accumulation. This is something that could be helpful to, along with diet and exercise, as well as hormone replacement therapy. And that study, just for reference, is Fultz et al. 2010 and Mengele et al. 2015. Another key finding from the study was a reduction in hepatic fat. So basically fat around the liver. So people with what was commonly called non-alcoholic fatty liver, also known as metabolic dysfunctional associated steatic liver disease, or NASH, non-alcoholic fatty liver disease. This would be another indication or a key use for Tesamorelin to remove or reduce the amount of fat accumulation around the liver. Just to go through that clinical trial, some of the most common adverse events were fluid retention, injection site erythema and itching, arthralgia, so like joint aches, muscle aches, and peripheral edema. Because Tesamorelin upregulates IGF-1, it is contraindicated in anyone with active malignancies or cancer. So again, Tesamorelin is one of the growth hormone releasing hormone secretagogues. So this is mimicking or telling our body to secrete natural endogenous growth hormone. It's not the administration of growth hormone. That's the key difference in these peptides. And there are more in this class. There is Samorelin and Ipamorelin, also with CJC 1295. That these are other ones that I will go over in depth in another video. So let me know what questions that you guys have, and I'll see you in the comments.